Hello viewers of AraaTech. Today the topic is BBI. In a recent exploration of brain-computer interface technology and its potential implications, we discovered significant developments in brain-to-brain interface BBI, heralding a new era of direct brain communication. However, amidst our research, we stumbled upon the news of Elon Musk's Neuralink project encountering regulatory obstacles in its quest to install brain implants. Initially hailed as a groundbreaking advancement, Musk's ambitious endeavor faced a setback as US regulatory authorities intervened, citing potential risks to human life. Despite this setback, the journey through the evolution of brain interface technologies remains a fascinating one, showcasing both the remarkable progress and the challenges inherent in pushing the boundaries of scientific innovation. Join us as we delve into the intricacies of these developments, examining the intersection of technological advancement and regulatory scrutiny. Watch until the end to gain insights, and don't forget to like, subscribe, share, and comment on the intriguing journey of exploration and discovery. Let's start our topic. Brain to brain interfaces BBIS represent a revolutionary advancement in the realm of direct communication, enabling direct interaction between two brains without relying on the peripheral nervous system. This innovative technology comprises two essential components: brain-computer interface. The BCI aspect of BBIs is responsible for detecting and interpreting neural signals originating from one participant's brain. These signals are typically recorded using techniques like electroencephalography (EEG) or functional magnetic resonance imaging (fMRI). The BCI translates these neural signals into actionable commands or data that can be processed by a computer. Computer brain interface (CBI). On the other end of the BBI system is the CBI, which serves to transmit information or stimuli from the computer to the recipient's brain. This interface can utilize various methods such as transcranial magnetic stimulation (TMS) or transcranial direct current stimulation (TDCS) to deliver targeted stimuli to specific regions of the recipient's brain based on the interpreted neural signals. Together, these two components form the foundation of BBIs, enabling seamless bidirectional communication between individuals' brains. This breakthrough technology has the potential to revolutionize fields such as healthcare, neuroscience, and human-computer interaction by facilitating direct neural communication and collaboration. Recent advancements in multi-person BBIS. The study represents a significant advancement in the field of brain-to-brain interfaces. Background: brain-to-brain interfaces enable direct communication between the brains of individuals, facilitating collaboration and information exchange without the need for traditional sensory or motor pathways. Study objective: Jiang aimed to develop and demonstrate the feasibility of a multi-person non-invasive BBI system capable of enabling collaborative problem-solving tasks. Methodology: Participants: 3 individuals participated in the study, each assigned a specific role. 2 participants, termed senders, provided input for the collaborative task. 1 participant, designated as the receiver, received and processed the input to perform the task. Experimental setup: the participants engaged in a collaborative task resembling a Tetris game using an interface named BrainNet. EEG was employed to record brain signals from the two senders while they made decisions related to the task. Signal processing. The EEG signals recorded from the sender's brain were decoded and processed to extract relevant information. The decoded information was then transmitted to the receiver using transcranial magnetic stimulation (TMS). Task execution. The receiver, based on the transmitted information, made decisions and performed actions in the Tetris-like game interface. Key findings. Successful collaboration. The study demonstrated successful collaboration among the three participants using the BrainNet interface. Information transmission. EEG signals from the senders were effectively transmitted to the receiver via TMS, enabling the receiver to perform the task based on the received information. Feasibility of multi-person BBIs. This research provided evidence for the feasibility of multi-person non-invasive BBIs in facilitating collaborative problem-solving tasks. Significance and implications. Advancement in BBI technology. The study represents a significant advancement in the development of BBI systems, particularly in enabling collaboration among multiple individuals. Potential applications. Multi-person BBIs have the potential to revolutionize various fields, including healthcare, education, and human-computer interaction, by facilitating direct neural communication and collaboration. Future directions. Future research in this area could lead to the development of more sophisticated and versatile multi-person BBI systems with broader applications and capabilities. In summary, the study by Jiang demonstrated the successful implementation of a multi-person non-invasive BBI system, showcasing its potential for collaborative problem-solving tasks and paving the way for future advancements in this exciting field. Proof of concept and future directions. Jiang study serves as a pivotal proof of concept for the potential of collaborative problem solving using multi-person brain-to-brain interfaces (BBIS). Feasibility demonstration. Collaborative problem solving. The study showcased the ability of multiple individuals to work together and solve tasks collaboratively through the use of BBIS. This represents a significant step forward in demonstrating the practical application of BBIS beyond individual brain communication. Multi-person BBI validation. By successfully implementing a multi-person BBI system, Jiang proved empirical evidence supporting the feasibility of such networks. This validation is crucial for establishing the viability of multi-person BBIs as a technology for real-world applications. Building upon previous research. Direct BBI studies. Jiang research builds upon previous studies in the field of direct BBIs, which have primarily focused on establishing communication between two individual brains. Their work extends the capabilities of BBIs by enabling communication and collaboration among multiple participants simultaneously. Incremental progress. The study represents an incremental but significant advancement in the development of BBIS, contributing to the cumulative progress of research in brain-to-brain communication. Each successful demonstration, like Jiang's study, further solidify the potential of BBIs for various applications. Promise for future applications. Expanded use cases. The successful demonstration of collaborative problem solving using multi-person BBIs opens up new possibilities for their application in diverse fields such as healthcare, education, and teamwork in complex tasks. Technological advancements. Jiang's study paves the way for future advancement in BBI technology, including improvements in signal processing algorithms, interface design, and hardware capabilities. These advancements could lead to more robust and versatile BBIs with enhanced functionality. Conclusion: Jiang's research represents a significant milestone in the development of multi-person BBIs, demonstrating their feasibility for collaborative problem-solving tasks. By building upon previous studies and showcasing the potential of BBIs in real-world applications, their work lays the foundation for further exploration and innovation in the field of brain-to-brain communication networks. Expanding capabilities and ethical considerations. Expanding the capabilities of brain-to-brain interfaces (BBIs) represents an exciting avenue for future research with the potential to unlock more sophisticated forms of communication and interaction. Enhanced information complexity. Future research directions. While the current study demonstrated simple binary communication, future research aims to enhance information complexity using advanced techniques such as functional magnetic resonance imaging (fMRI) and transcranial focused ultrasound (TFUS). fMRI and TFUS. These techniques offer higher resolution and greater precision in monitoring and modulating brain activity, potentially enabling more nuanced and detailed communication between individuals through BBIS. Ethical considerations. Privacy. As BBIs become more sophisticated and capable of transmitting complex information, ensuring the privacy of individuals' neural data becomes paramount. Ethical guidelines and safeguards must be implemented to protect sensitive information from unauthorized access or misuse. Agency. Individuals must retain control over their own thoughts, decisions, and actions when using BBIS. Ethical considerations include ensuring informed consent, respecting autonomy, and preventing coercion or manipulation in BBI interactions. Autonomy. The ability of individuals to make independent choices and decisions is essential in BBI technology. Ethical guidelines should uphold the autonomy of both senders and receivers, allowing them to opt in or out of BBI interactions freely and without undue influence. Informed consent. Participants in BBI experiments or applications must provide informed consent, fully understanding the potential risks, benefits, and implications of participating in BBI interactions. Researchers and developers have a responsibility to communicate transparently and honestly about the capabilities and limitations of BBI technology. Equity and access. Ethical considerations also include ensuring equitable access to BBI technology and addressing potential disparities in access based on factors such as socioeconomic status, disability, or geographical location. Conclusion. As brain-to-brain interfaces continue to advance, it is crucial to address ethical considerations alongside technological developments by proactively addressing privacy, agency, autonomy, and other ethical concerns. Researchers and developers can ensure that BBI technology is used responsibly and ethically to benefit individuals and society as a whole. Future contexts and ethical implications of multi-person BBIS medical applications. Assistive devices. Multi-person BBIs offer performing applications in the medical field, particularly as assistive devices for individuals with physical disabilities such as paralysis or locked-in syndrome. By enabling direct brain communication, BBIs could facilitate communication and control of external devices, enhancing independence and quality of life for individuals with motor impairments. Social networks. Large networks of interconnected brains. Envisioning large networks of interconnected brains introduces intriguing possibilities akin to social media platforms. These networks could facilitate real-time communication and collaboration among individuals, transcending traditional boundaries of space and time. Potential applications: gaming. Multi-person BBIs could revolutionize gaming experiences by allowing players to interact and collaborate directly through their brains, creating immersive and engaging gameplay scenarios. Enhancement: BBIs could be utilized for cognitive enhancement purposes, enabling individuals to augment their cognitive abilities of share knowledge and skills directly with others. Encryption: the secure transmission of information in a critical aspect of BBIs. By leveraging encryption techniques, multi-person BBIs could provide a secure platform for confidential communication and data exchange among network participants. Ethical considerations: privacy and consent. As with any technology involving the transmission of sensitive information, ensuring privacy and obtaining informed consent from participants are paramount. Ethical guidelines should address concerns related data security, confidentiality, and individual autonomy. Equitable access. Ethical considerations also include ensuring equitable access to multi-person BBI technology, particularly in healthcare contexts. Efforts should be made to address potential disparities in access based on factors such as socioeconomic status or geographical location. Enhancement and fairness. The use of BBIs for cognitive enhancement raises ethical questions regarding fairness and equity. Careful consideration must be given to the potential societal implications of enhancing cognitive abilities through direct brain communication. Regulation and oversight. Ethical frameworks and regulatory mechanisms should be established to govern the development, deployment, and use of multi-person BBIs. Oversight by regulatory bodies can help ensure that BBIs are developed and utilized responsibly with due consideration for ethical, legal, and social implications. In conclusion, while multi-person brain-to-brain interfaces hold immense potential for medical applications as social interaction, careful consideration of ethical implications is essential to ensure that the technology is developed and utilized in a responsible and ethical manner, benefiting individuals and society as a whole. Ethical challenges and autonomy in multi-person BBIs. Voluntary participation and informed consent. Paramount importance. Ensuring that individuals participate voluntarily and provide informed consent is crucial in the development and deployment of multi-person BBIs. Participants must have a clear understanding of the nature of the technology, its potential risks and benefits, and the implications of their involvement. Informed consent. Ethical guidelines should mandate the provision of comprehensive information to participants, enabling them to make informed decisions about their participation in BBI interactions. This includes transparency about data collection, storage, usage, and potential risks associated with BBI technology. Protecting individual autonomy. Transparency and control. Upholding individual autonomy requires transparency regarding the collection, processing, and utilization of neural data in multi-person BBIs. Participants should have control over their own neural signals and the ability to opt in or out of BBI interaction freely. Mechanisms for control. Implementing mechanisms to control signal reception and mitigate potential harm is essential for safeguarding user autonomy and mental integrity. This may involve providing participants with tools or settings to regulate the intensity or frequency of BBI interactions, ensuring they retain agency over their own cognitive processes. Mitigating potential harm. Risk assessment. Ethical considerations in multi-person BBIs include assessing and mitigating potential risks to participants' well-being and mental health. Developers must anticipate and address potential adverse effects such as psychological discomfort, cognitive overload, or unintended manipulation. Safety protocols. Establishing safety protocols and guidelines for the use of multi-person BBIs can help mitigate risks and ensure responsible deployment of the technology. This may involve monitoring participants for signs or distress or discomfort during BBI interactions and providing support or intervention as needed. Conclusion. In summary, ethical challenges in multi-person brain-to-brain interfaces resolve around ensuring voluntary participation, protecting the individual autonomy, and mitigating potential harm to participants by prioritizing informed consent, transparency, and user control. Developers and researchers can uphold ethical principles and promote responsible use of BBI technology, ultimately benefiting individuals and society as a whole. Collective decision making and agency in BBI networks. Importance of joint commitment. Crucial for collaboration. In large brain to brain interface networks, negotiating joint commitment among participants is essential for effective collaboration and decision making. Joint commitment entails a shared understanding of goals, responsibilities, and contributions within the network. Facilitating cooperation. By establishing joint commitment, BBI networks can facilitate cooperation and coordination among participants, enabling them to work towards common objectives and outcomes. Understanding individual roles. Clarity and communication. Clear communication and understanding of individual roles within the BBI network are paramount for effective collaboration. Participants must have a clear understanding of their responsibilities, contributions, and expectations within the network. Allocation of tasks. Assigning tasks and roles based on individuals' strengths, expertise, and preferences can enhance efficiency and productivity within the BBI network. This ensures that each participant can contribute effectively to the collective decision-making process. Concept shaping the ethical framework. Extended autonomy. In the context of BBI networks, the concept of extended autonomy acknowledges the interconnectedness of individuals' decision-making processes within the network. Extended autonomy recognizes that individual autonomy is not solely determined by internal factors but also influenced by external interactions and collaborations within the network. Joint agency. Joint agency refers to the collective ability of individuals within the BBI network to act together towards common goals and objectives. This concept emphasizes the shared responsibility and agency of participants in shaping the outcomes of BBI interactions and decisions. Ethical implications. Shared responsibility. Ethical considerations in BBI networks include acknowledging and addressing the shared responsibility of participants for the outcomes of collective decisions and actions. This requires promoting transparency, accountability, and mutual respect within the network. Equitable participation. Ensuring equitable participation and representation within BBI networks is essential for upholding ethical principles such as fairness, inclusivity, and respect for diversity. All participants should have the opportunity to contribute to decision-making processes and have their voices heard within the network. Conclusion. In conclusion, collective decision-making and agency play a central role in shaping the ethical framework of brain-to-brain interface networks. By fostering joint commitment, understanding individual roles, and embracing concepts like extended autonomy and joint agency, BBI networks can promote collaboration, inclusivity, and ethical conduct among participants, ultimately enhancing the effectiveness and impact of collective decision-making processes. Neuralink's regulatory challenges and Elon Musk's ambitious vision. Neuralink. Elon Musk's venture aimed at revolutionizing brain-computer interfaces faces regulatory hurdles as it strives to bring its groundbreaking technology to human trials. Despite Musk's bold predictions and promises, the company's application for FDA approval was rejected in early 2022 due to concerns over safety issues with the brain implant device. The FDA outlined significant issues related to the device's lithium battery, wire migration risks, and removal procedures, highlighting the complexities involved in ensuring the safety and efficacy of such innovative medical technology. Neuralink's regulatory struggles underscored the tension between Musk's ambitious timelines and the rigorous requirements of regulatory agencies. Musk's grand vision for Neuralink, including ambitious claim of curing conditions like paralysis and enabling telepathic communication, has propelled the company's valuation to over $1 billion. However, the challenges of navigating FDA approval processes and addressing safety concerns pose a critical test for the company. Despite Musk's confidence and public statements, industry experts caution that Neuralink may face substantial barriers to achieving regulatory approval and bringing its transformative brain implant technology to market in the near future.